My name is Benjamin Stalmakov. I am a student at Rasmussen College. Today's topic is type 2 diabetes. Type 2 diabetes is when somebody's body cannot produce enough insulin. This leads to many dysfunctions in the body. It also can be fatal if not treated properly. It is also a growing problem in America at this very moment. Over 29.1 million Americans have diabetes, and this number is expected to rise. It is a progressive disease and is also hard to manage. It's the seventh leading cause of death in the United States, and 15 to 30% of people in the US will develop type 2 diabetes in the next 5 years, which is a scary thought. Here's just a chart showing what I just explained. The percentages of people that shall get diabetes, unfortunately. Insulin is a hormone that your body produces to break down sugar, or otherwise known as glucose. This process creates energy for your cells. A person with diabetes does not have enough insulin, which causes the sugar to build up in a person's body, specifically in the person's arteries, as is shown right here. Here's the buildup. This leads to high blood sugar, which can affect the person in many different ways. High blood sugar can cause feeling hungry, tired, thirsty. Also can cause dry, itchy skin and blurred vision. Also, frequent urination. Look for these signs. Signs often take a while to become obvious and are not attended to for years because the person did not notice it, which is a huge problem. Some signs would include feeling tired, thirsty, weight loss, frequent urinations, intense hunger, and last but not least, dark brown spots. They are usually located in the neck or armpit region, and this is called acanthosis nigricans. Effects. Fluid might be pulled back from the lenses of the eyes, causing the person to not be able to focus. Affects your ability to heal and resist infections, aka your immune system stops functioning properly and cannot fight pathogens the way it should be. Fatigue or feeling tired or irritable is also an effect of type 2 diabetes. Some treatment plans. Typically, a treatment plan would include some sort of diet and physical exercise. It is very important. Metformin is one of the first medications provided to a type 2 diabetes patient. And Farxiga is a medication taken by patients who are trying to reach the right A1C levels, aka blood sugar levels. Metformin. The way metformin works is it increases your body tissue sensitivity to insulin and allows it to use it more efficiently. Glucose production is also lowered. May not be able to lower blood sugar levels on its own, or you will have to take another medication. Farxiga. Wouldn't recommend it, but this medication has many things that do not go well with it and has multiple serious side effects. Some side effects will include dehydration, ketoacidosis, kidney problems, serious urinary tract infection or UTI, lower blood sugar, hypoglycemia, and many more unpleasant situations. Some short-term effects of type 2 diabetes would include very low blood glucose or hypoglycemia. Hypersmolar causes severe dehydration and increases in osmolality, relative concentration of solutes, and a high risk of complications, coma, and even death. Hyperglycemia just stands for abnormally high levels of glucose, aka sugar. Non-ketotic syndrome, or HHNS, is a very high blood glucose. Some long-term effects: diabetic retinopathy is a diabetic complication that affects the eyes. It is caused by damage to the blood vessel of the light-sensitive tissue at the back of the eye, or other known as retina. Kidney disease, damage, nephropathy, is in severe cases, it can lead to kidney failure. Diabetic neuropathy is nerve damage that occurs if you are diabetic. High blood sugar can damage nerve fibers throughout the whole body, but diabetic neuropathy usually targets your legs or feet. Vascular problems is a disease of any large blood vessel in the body. And lastly, here is my reference page. Thank you very much for watching. Have a nice day.